Hi everyone, my name is Bianca Rhodes, and today I'm going to be presenting to you the disease rubella. So, rubella virus is also known as German measles or three-day measles, and it is a contagious disease caused by a virus called the ruby-virus. And this virus differs from the one that causes measles, which I will discuss later on. And so the rubella virus is the sole member of the genus Rubivirus, and it is in the family of the Togaviridae, which is right here. This is a positive stranded RNA virus that causes fever and rash in mammals, and it can also cause other things such as arthritis and encephalitis. So we no longer see the rubella virus as as endemic in the United States, and we can see that it is brought into the United States from other countries that don't have as many vaccines and are prone to disease. So around 30 to 50% of people infected with rubella don't have any symptoms, but these are the usual occurring symptoms consisting of severe headache, vomiting, sore throat, skin rash, organ inflammation, muscle pain, joint pain, and runny nose and sneezing. Rubella is usually mild with few noticeable symptoms. For children who do have symptoms, we see that red rash appearing in the face, which is typically the first sign. And then most adults who get rubella usually have mild illness, which is pretty much a low-grade fever, sore throat, and sometimes it has a rash in the face and it starts to spread throughout the body. And up to 70% of women may experience arthritis as a symptom, which is pretty interesting as a rubella complication. And this is rare in children and men, so it's usually only seen within women. And then these are just a visual aid of the symptoms that occur within rubella. And here is more pictures of that severe skin rash that we see. And this is within a child, as well as this one that is starting in the face. So we know this is a first sign. And then this one has spread all the way down to the neck. So we know it is increasing. So rubella is diagnosed usually through a laboratory test consisting of blood tests, nasopharyngeal or throat swabs, urine test, polymerase chain reaction testing, and molecular testing. And so a polymerase chain reaction testing is a viral specimen that is collected and tested for rubella using that polymerase chain reaction. And molecular typing is a viral specimen that is collected and tested for rubella using molecular typing. And it can also be diagnosed through medical history if it is seen within the family history, as well as physical examination for that skin rash or other symptoms that have occurred that point to rubella. So rubella is a highly contagious, and it is usually most contagious when the infected person has the rash. But it can spread up to 7 days before and after the rash appears. So it is usually conducted through direct contact of the infectious person, nasal or throat secretion, so breathing in that infectious person's droplets from their coughs or sneeze, or even sharing drinks or food with an infected person can cause rubella. And we see that 25 to 50% of people with rubella do not develop any symptoms, as I said before, but they can still give it to others. And this can still spread or this individual can still be contagious for up to 1 week and before or after the rash appears, like I said. So the prevention and treatment for rubella consist of the MMR vaccine, which means the measles, mumps, and rubella vaccine, and this is seen to be 97% effective at preventing rubella. And this vaccine is usually given the first dose between 12 and 15 months and the second dose between 4 and 6 years old. And teenagers and adults should stay up to date with their injections. So if they have not been vaccinated, they should do that. And as well as good personal health and hygiene, such as the image on the right, as it shows to wash your hands, cover your cough and sneeze, and get your vaccines. And treatment usually just consists of rest, fluids, and pain relievers because we don't see other treatments that do much for rubella. So, rubella during pregnancy is a serious health issue to pregnant women, and it's called congenital rubella syndrome, or CRS, which is preventable by getting the vaccine before pregnancy occurs, but it causes major complications such as miscarriage or stillbirth, birth defects, most severe during early stage of pregnancy, around 13 weeks of pregnancy. And CRS has become pretty rare in the United States because the spread of the vaccine. However, there are still 100,000 cases seen every year around the world, and the initial signs of CRS right after birth may include a low birth weight, multiple blue or purple circled shape marks on the skin, or even bumps that are often called a blueberry muffin rash. We also see purple, red, or brown spots on their skin, which is referred to as purpura. And we can also see a small head size. And some other features of CRS that may become apparent later on could be cataracts or glaucoma, pneumonia, hearing loss, enlarged liver or spleen, developmental delays, bone disease, swollen lymph nodes, and so babies born with CRS also have an increased risk of developing insulin-dependent diabetes and thyroid disease later on in life. So many individuals confuse rubella and measles because they could be similar in some aspects. They both cause fever and rash, and they are spread through a viral infection, but measles is seen to be more contagious than rubella and is also more severe within pregnant women. However, rubella is seen to be more severe to an unborn child and can affect them more later on in life than someone with measles. But the MMR vaccine, the measles, mumps, and rubella vaccine, is used for both of these diseases. So we can see that rubella is caused by the rubella virus, or the rubivirus, as we said earlier. It causes pink spots that start on the face and spread down. And it consists usually of a mild fever of 101 degrees Fahrenheit or lower and doesn't usually go above that. While in measles, however, it is caused by a paramyxovirus. It can be seen to have red and blotchy patches on the skin instead of those pink spots. And we can see that it starts at the hairline and it spreads downwards, and it consists of a higher fever of 104 degrees Fahrenheit or higher, which is why it can be more severe to a person's health, because this temperature can cause denaturation of proteins and can cause someone to die. And we can see in this little figure below that measles and rubella do differ in some of the disorders that we see it causes, but it can be similar in others. So we see that measles can cause pneumonia and diarrhea, while rubella causes heart disorders, and we can see that both consist of brain damage, deafness, and blindness. So within current research, we see that we are trying to further understand genetic factors that are influencing the immune response to the rubella vaccine, because we want to understand the vaccine's effectiveness. And so to do that, we have to understand the genetic factors that are being influenced by the vaccine. Another one is identifying the high-risk population of the infection, which we can use surveillance to do. And this is important so that we can understand who needs the most help and how we can decrease the number of rubella cases in the world. And we can do this through the vaccination programs, especially in regions with low vaccine rates, because the ultimate goal, again, is to eliminate rubella globally. And so we want to improve those vaccine strategies by investigating optimal vaccination schedules, strategizing the maximize coverage of people that can get the vaccine, and we want to protect against outbreaks so that we eliminate the spreading of the disease to others that are not affected by it. And so we need to include research on new vaccine formulas that could be easier to get out to people. And so we also want to further study the CRS diagnosing and treatment, And this is important because we want to understand the development and methods in order to better diagnose and manage cases in newborns to prevent the amount of cases that are occurring. Um, we also would like to do molecular studies to further analyze the genetic makeup of the rubella virus so that we can understand its evolutionary process and the potential for emergence of new variants. And so that if we need to improve the vaccine in order to prevent rubella that has been evolved, we are able to do so. And that is my presentation on the rubella virus. Thank you so much for your time. It was greatly appreciated.